Hi, my name is Samantha Vargas, and I'm going to be talking about dissociative identity disorder. Imagine waking up one day and one of your parents or guardians changes their personality. I mean, they change the way they walk, talk, their gender identity. They even have an accent. And let's say this happens 30 minutes to an hour every other day. Or sometimes it happens twice a day. How would that make you guys feel? You would feel scared or worried, right? What if I told you that some of us are detached from our immediate surroundings for a short period of time? For example, we get lost in a book for 10 minutes, or we daydream, which I do all the time during class. Or you forget you did a task, like put your phone in your backpack and you don't even remember putting your phone in your backpack. Trust me, this happens to all of us, and it's all normal. Most of these cases are known as dissociative identity disorder, but most people know it as multiple identity disorder. Dissociative identity disorder is a mental process which produces a lack of connection in a person's thoughts, memories, feelings, actions, and is known as multiple personality disorder, which causes individuals to have two or more identities or personalities. In today's speech, I'm going to go over and inform all of you about dissociative identity disorder and how all this affects a person. I will go over the causes, the effects, the symptoms, and the treatments for this disorder. I'm going to start off by talking about symptoms it brings. Apart from severe lack of connection between the thoughts, memory, sense of identity, individuals affected with this disorder also experience memory loss. And in this picture I'm going to present just goes over the things I went over, which is most people with this disorder go through memory loss, changes in skills, their thoughts. They're feeling different, like they have different identities inside of them. They forget, amnesia, dissociation, and so on. A person with dissociated identity often have a main personality, which that main personality is either passive, dependent, or sometimes depressed. With their alternate personalities, they're called alters. And most of these alters may not be present or may be present while switching. They have different names, gender identities, behavior, sense of age, and so on. In 2019, Stewart talks about how there are different people with personalities, and depends on the person. Some people have 2 to 4 personalities. Another person may have 10 to 16 personalities. In this image I'm going to present, they're mostly the statistics of a person with this disorder has. So the average a person has 2 to 4 personalities, and the most severe of this disorder may have 13 to 15 personalities. With this, it's very difficult for a person, especially if they're forgetting what they're at and if they're transitioning mid-sentence with a person. Many people who observe a person with dissociative identity disorder observe their body posture, their body language, and their eye contact changes. And most of it is just bizarre and scary that you're witnessing something just like this happen to someone. Now that I gave you a little gist of the symptoms that comes with it, I'm going to start talking about the causes. Some of the causes include abuse, mostly in your childhood. In an article I read about a woman called Melanie Goodwin, she talks about how from the ages 3 to 16, she was abused. And she talks about how she doesn't remember any of those years until her personality disorders came out. She talks about how some of her alters are triggered by the sense of smell, the way a man walks, or a certain noise like the bus. She goes on talking about how it's disrupted her life and the way of living and how she felt trapped. Thankfully, she talked to someone about it and she realized that she's not alone and there's more things to do. An article from spring 2019, Melanie talks about how there's a rapid awareness of many different identities and opposing that are overwhelming her. She has about 10 personalities, and the more she talks about her childhood, the more she knows how to control it and when they could appear. My last topic, I will be talking about different treatments that could help this disorder. Unfortunately, there are no medication that could treat this disorder, but there are many supportive therapies that can. However, people with this disorder have associated depression or anxiety. They may benefit from antidepressants or anti-anxiety pills depending on your case and the way you are triggered with depressants. The most approachable treatment for the disorder is psychotherapy, which is mostly just talking about your childhood, and therapy it's recommended twice a week and for about 2 hours, and it helps talking about what affected you and how it could help you and what triggers these alters. Another important therapy would be cognitive behavioral therapy, which is a therapy that helps and provides patterns, feelings, behavior, eye movement. It helps do different strategies instead of just talking. Mostly just therapy helps. The most effective one is psychotherapy, though. Today I explained what dissociative identity disorder is, aka multiple identity disorder, and the symptoms and causes and the helpful treatments to control it. All in all, this treatment has taught me about the seriousness and reality and the existence of dissociative identity disorder. I learned that symptoms and treatments can help, but this disorder is very real and dangerous, and it's important to talk about your feelings so you won't get hurt. And it's okay to talk about your feelings and to help yourself. Thank you.